the ability to configure the screen in any way you want.
Put everything on one screen.
That's an advantage that I see of a Banyan.
And get a very crisp image.
Better visualization.
It just makes you more comfortable with what you're doing.
I think the screens are the eyes inside the body of exactly what they're doing.
The thing that the Banyan does for us is it does really increase the efficiency of everything.
It's convenient to have multiple screens right in front of me, so I don't have to turn my head and I'm looking and doing my case, and it's convenient to have everything right in front of you.
The other thing that I like about it a lot is the display. The display is large, and we can actually do the imaging on a large field of view, not magnified, and get a very crisp image. The good thing about that is that we can markedly reduce the dose to the doctor, and when you're doing this a long time, you want to reduce the dose as much as possible. So that's another thing that I really like.
You know, I mean, one thing is if a doctor needs assistance in another lab, we can actually send the images from lab 3 to lab 1, which is great because then we don't have to leave lab 1 to go to lab 3. So, you know, there's convenience that it provides.
It definitely makes everything more efficient, and it makes everything easier to use because it's very easy to navigate through. The toolbar on the side makes things very easy to use. You can also annotate freely on it, which is great. You can magnify anything you need, and it's just really user-friendly.
Another good thing is that you can, because it's a big screen and you can have two fluoro images at the same time, so one pre and one post, and you can show it to the patient. And the patients appreciate it, so when they look at it as to how they came in and how they are now, it gives them a visual perspective of what happened and what we did.
Yeah, well, we plan to have all the rooms on the Banyan system, so we can all be looking at the same thing, and everybody won't say, well, I want to work in that room because that's the Banyan room, or everybody will feel that they have the same kind of display, the same ability to see. And you can configure the display any way you want.
And switching from one template to another template is very easy. The touch screen is really good and responsive. I think it's been really good.
Easy to work with. I think Banyan's been easy to work with and very helpful, and also having people on board early on so that everybody, particularly the technicians and the physicians, feel comfortable. It's a new kind of system, but everybody feels, I think, very comfortable with it and likes it.
I think the Banyan system, you know, as far as like the visualizations and the user friendliness, actually helped me transition easier into the cath lab, because it was kind of like a hands-on experience, and seeing the monitors and the screens really helped me.
One thing I would say is we've had it for several months now, and I would say it's been a big addition. I don't think I'm fully literate in all of the things that it can do, but every day I'm impressed by what it can do. And one other thing that I would say that people were concerned about, and I had some concern about, and that is, well, what happens if your system goes down?
We have needed them for some technical issues. It was mainly a learning curve on our part.
And their responses are super quick. You can get an actual person on the phone in a matter of minutes, which is nice.
And they usually remote right in from their server.
There's a technician who takes over.
And they know how to fix it immediately.
They just walk you right through it.
So if something like that occurs again, you know how to fix it.
That service ability to have that right away has been very good. I've been impressed by it.
I think it's a great system, and it's really easy to learn, easily customizable. I would definitely use it again if I had a choice to make.